Good morning. Thank you all for being here. We're so excited to have everyone here in the audience as well as via live stream for this great program on technology and how nonprofits can use it to help further their missions. So thanks for making time today. I just want to give a brief overview of Foundation Center. Foundation Center is a nonprofit organization whose mission is to help advance knowledge about philanthropy in the U.S. and around the world. Here in the regional office at Foundation Center West, our main strategic priority in helping achieve that mission is to connect nonprofits to the resources they need to thrive. We do that by offering data resources upstairs in our resource center on the 6th floor, as well as online through grantspace.org and through our funding information network partners, which are about 400 across the world. We also provide training as well as convenings such as the one that you are attending today. So we appreciate you all being here, and I don't want to take up too much time because we want to get to the program. We're so excited to have the wonderful panelists here, and also our moderator, Cassie Grunstein, and she will be introducing the panel. Cassie is the principal of Cassie Grunstein Consulting, and she was the one that helped bring this wonderful topic to us, so I thank her for her leadership. Thank you.
Thanks, Michelle. It's really exciting to be here today discussing this. My background and my entire career, I grew up in the nonprofit space. So I am a development and communications professional by training, and so this topic is near and dear to my heart. I remember when technology came on the scene as a young professional, I had to convince my board of directors to support the implementation of the very first website for the organization, where I led communications and development, and why it was important that they spend, I think it was $5,000 on putting the website into place. I won't say when that was, but things have moved on since then in many ways. And I know from being in that space and then working as a consultant for 7 years to many organizations, that the question of how to integrate technology platforms into communications, as well as to help benefit our beneficiaries and the communities that we work with, continues to be an opportunity and a challenge for nonprofit leaders. For the last year, I worked as a global director of social impact for a global product design firm. And so I worked with teams of designers and engineers to help think through, from the beginning of a technology product design through implementation, how to work in partnership with social impact organizations that included nonprofits, public enterprises, governments, and social enterprises as well. And the concept of integrating digital is an ever-shifting landscape for everyone in the world, companies included, and we wanted to bring this topic to the table to be able to discuss in particular how it impacts organizations that are working with vulnerable populations and working in this area of social impact. So I'm really pleased to be here today and talking with peers, both here and on the live stream. And I'm excited to introduce our panel of experts, and I will walk through the list of the stellar background and experiences that this group brings to the table. Sitting next to me is Delia Coleman. She's a policy and strategic communications professional, serving the nonprofit sector for 12 years as an advocate, lobbyist, and policy communications practitioner. She is the director of strategic communications at an organization in San Francisco, Equal Rights Advocates. I'm having a moment. But prior to joining ERA, she was the vice president of strategy and public policy at Forefront, which is a regional association for foundations and nonprofits in Illinois. And she led the project to communicate the value of the Illinois nonprofit sector and demonstrate its social return on investment, which is called Building a Stronger Illinois. She also led the state's first statewide Giving Day campaign, Illinois Gives, for Givingtuesday, and it raised $11 million in 2016. Prior to joining Forefront, she was government relations officer for YWCA Metropolitan Chicago and helped build eminence for them to eliminate racism and empower women. So thanks for joining us, Delia. Next to her is Rachel Wick, who is a senior program officer at Blue Shield of California Foundation. And she advances strategies designed to support care integration and value-based care in the California safety net, including behavioral health integration, electronic consultation between primary care and specialty care systems, and accountable communities for health. The foundation is constantly evaluating and receiving proposals for technology solutions. So it's a topic the Blue Shield has spent much time discussing internally and working on. And they've made the decision to fund the packaging or bundling of tech solutions that help grantees think through why tech and how tech first. Before joining Blue Shield of California Foundation, Rachel spent 8 years at the Consumer Health Foundation in Washington, D.C., helping implement and evaluate health equity and advocacy strategies, first as a program officer and then as the director of policy planning and special projects. Welcome, Rachel.
Thank you.
And Cameron Jones is responsible for the development of new technology solutions and services at TechSoup Global, and she better supports nonprofits worldwide in the successful selection and adoption of technology. Her work includes technology advice, IT support and implementation services, online courses designed for NGOs, membership and subscription offers. In addition, she manages TechSoup's global hardware programs, including Cisco, Dell, Lenovo, and Infocus. Prior to TechSoup, Cameron worked in the private sector in the United States, Europe, and Asia, managing distribution networks, leading marketing strategy efforts, and managing corporate services. And TechSoup's goal is to be the go-to marketplace for support and software for nonprofits looking to integrate technology solutions. And they are providing a lot of new resources, which I think the community will be interested in hearing more about, including hardware programs, advisory, and IT support services to nonprofits, as well as trainings and design support. So welcome to everyone on the panel. We want to jump in. I would like to point out to everyone in the room and on the live stream too that I'm really excited to have a team of women who are talking about technology. I know this is a topic that comes up a lot. I asked our panel, should I mention this? And they were excited to say that yes, we wanted to mention the group of all women talking about how this world works. So I'd like to ask everyone on the panel to give a brief introduction outside of the intros that I just read to everyone and tell us what you see as major opportunities in the nonprofit sector for organizations to engage in digital transformation. And digital transformation is a phrase that was new to me in the last year. And Wikipedia defines it as the transformation of business by revamping business strategy or digital strategy models, operations, products, marketing objectives by adopting digital technologies. And I would love it if you could share an example of how you're seeing the process of digital transformation come into your work with nonprofits. Delia.
Thanks. Thanks, Cassie. So I'm the Director of Strategic Communications at ERA, and but that hasn't always been the hat that I've worn. For most of my life in the nonprofit sector, it was around public policy and advocacy. And so when I think about the definition of digital transformation, it hews very closely with the definition that I'm used to when I came from the corporate sector around strategic communications, which is different from marketing, which is about driving an organization's bottom line through very strategic kinds of communication. So what does that have to do with digital transformation? For me, I think what I've seen change is how engagement of stakeholders, particularly around whatever subject issue or issue area a nonprofit might have, has changed from let's send a newsletter to how can we make sure we're reaching the right population at the right time to get them to take an action on our behalf so that we can change policy. More and more that is becoming a numbers and targeting game. And I use the word game very deliberately because it is like a game. You need to have a strategy, you need to have tactics, you need to have a goal, you need to have a target. And there needs to be a win. And I think that has been, over time, one of the most game-changing things that I've seen in the sector. And keeping an eye on nonprofit organizations who do it well, and then keeping an eye on those organizations who want to do it well but are still trying to build capacity to get to that point. It's been fascinating to watch both from a distance, but in real time, as a director of communications, trying to do that same thing and build that kind of capacity in a small, scrappy organization. You learn how to be strategic real fast because you can't do all things all the time. So you have to pick the right tool, the right platform, the right target most of the time, and that takes a lot of work and capacity.
Good morning, everyone. I want to start by talking a little bit about Blue Shield of California Foundation, because that'll inform a lot of the perspective that we have on this question of digital transformation. So we're a foundation that works here in California. We work statewide. We provide about $30 million in funding annually to nonprofits across the state. And our goal really is to make California the healthiest state in the nation with the lowest rates of domestic violence. So we've done deep work in both the healthcare sector and the field of domestic violence. And as we've thought about this question of digital transformation, we've really come at it through two kind of guiding principles or values in the way that we've done our work as a funder. One has been really trying to support nonprofits in cultivating a culture of innovation. And you know, I know that's a buzzword in philanthropy, but it's essentially any time an organization, a foundation is trying to do something different that they haven't done before to solve a sticky problem or a pain point in the work that they're doing. And so using that broad definition, we think that's a culture and a mindset that nonprofits need to have in all of their work, whether it involves technology or not. And it's something that we've really tried to support through training and technical assistance and leadership development in the sector broadly. The other principle that's guided some of our work in technology is really around, in the healthcare side, we call it patient experience. On the domestic violence side, we call it survivor experience. In technology, they call it user experience. But really, it is centering everything that we do around the experience of those that we're trying to serve or that we're trying to reach. And whether you're a nonprofit that's serving a specific population, or increasingly, we're looking at the community level enterprise of this work and saying, you know, an individual interacts with multiple organizations, government, and systems, and there's some real opportunities there to create an experience for them that's seamless. And so a driving question for us has been, how do we really better design services and systems to meet the needs of patients, families, and communities across our state, and how do we use these new methods like human-centered design or increasingly complex kind of systems thinking and analysis to understand the problems we're trying to solve for and generate solutions. And kind of bringing this back to the question of digital transformation, technology is a core piece of innovation. And I think we all know that in the lives that we live. And I think for particularly underserved and under-resourced communities, the power of technology to make life easier, care experiences more seamless, services more accessible and more efficient. There's just a huge opportunity for us to do more. The one thing I'll say about technology that we've learned in working with a lot of nonprofits is we've really cautioned folks against technology as a plug-and-play enterprise. And so anytime we talk about technology, the technology is a tool. It's only as good as the people, the relationships, the understanding of the problem you're trying to solve for, and the different possible solutions, of which there are probably many, and technology being a tool that can really be leveraged in thinking about those kinds of problems. So we always say, you know, technology is powerful, but it's only as good as kind of the people and the analysis that's behind it.
Thank you for that. Cameron.
Hi, I'm Cameron Jones. I'm with TechSoup, and we're a. Does anyone not know TechSoup in the room? Are you all familiar with TechSoup? Okay, so I won't do a big song and dance about who we are. You know, as you mentioned, we're kind of a marketplace or a resource center. We're trying to consolidate technology resources for nonprofits so that they can go out and save the whales and clean up the environment and, you know, serve domestic violence victims. And what we do is digital transformation all day long. This is what we help organizations try to figure out. So not only do we provide the hardware and software through kind of our catalog programs, but we also have advisory services and IT support services that are helping organizations actually do this transformation. And so to Rachel's point, there are a lot of tools out there, and it's kind of been this explosion in the last 10 years of the number of tools out there that kind of do the same thing, but they don't all do exactly the same thing, and some are more expensive than others. So that evaluation process of tools is tricky and confusing. And then you also have this situation where you've got people talk about digital transformation and they're like, okay, we're going to revamp everything that we do. We're going to take, we're going to throw everything out. We're going to bring everything new in. And it really needs to be staged. I mean, the successful digital transformations that we've seen are done in piecemeal. You can have kind of a grand strategic plan of, we need to upgrade our email, get into the cloud for email and document storage. We need to build out security systems. We need to kind of centralize our communication systems. We need to build out a marketing strategy and get up on, Google AdWords and Facebook ads and all that stuff. But trying to do all of that at once, first of all, you'll fail because it's just too much to bite off. And second of all, a lot of these tools require changes in habits and changes in some habits that are long-standing. So I don't know how many of you out there have like a P drive or an H drive that everyone puts their documents on together. If you're starting to put documents in the cloud and start to do online collaboration, you have to change the way you think about how you store documents, how you tag documents. And so every time you implement a new system as part of your kind of ongoing digital transformation, it requires a change in your staff's thinking and processes. And some of them are not going to want to do those changes, and it's challenging. So, but it can be done if it's done thoughtfully with a lot, to Cassie's point, a lot of communications is really important in terms of getting people to understand what we're doing, why we're doing it.
Thank you, Cameron. I think that's really helpful, and I think it actually leads us directly into the next question. Your point about the fact that digital transformation is not one thing all at once. It's a process over time, and it can be staged, I think is a really helpful thing to think about, especially since all of us who are thinking about how to integrate technology tools into our organizations or into our programs often don't know where to start. So maybe, I wanted to ask each person on the panel to discuss with the audience a specific example to highlight what we mean by digital transformation and what it looks like when it's successful. And I'm thinking maybe it would be helpful to talk about it in the story mode of, what an organization sort of came to you or you saw at the beginning, and then how that worked over time. Could you start us off and share a good anecdote or example of something you've seen that's been successful in the nonprofit space?
So I have a great one, which actually I wanted to talk to Rachel about afterwards. So our Irish partner, so TechSoup works globally, and we have partners in lots of different countries that deliver the TechSoup program in those markets. And our Irish partner is particularly skilled at building applications, and they mostly build applications that sit on top of Salesforce. And they had a couple of addiction services organizations come to them and say, we've got reams of paper and, an old Access database that we're working on, and we're trying to figure out a better way of collecting data on our constituents, on our volunteers, on our programs, on our events. And so they built this application that sits on top of Salesforce, and they deployed it to these 3 organizations. And then those 3 organizations told all their other addiction service organization friends, and those guys came and adopted the same application. And so now I think it's 95% of addiction service organizations in Ireland are using this specific application to collect data, and it's become so powerful for them because they have been able to aggregate data on a national basis and then go to the government and say, look, we have a new drug problem. Like, we've got this new drug that's come up that people are using. We don't have a good way to address that, and we need different funding. Or we need to, we need more funding in this area, or we need, we can cut back on this because nobody's using, or they've legalized marijuana and we don't use this anymore, or whatever. But it's been really transformative for them in terms of being able to fundraise, in able to direct their funding appropriately for greater impact, and to do awareness building within the community to say, this is what we're seeing. We're seeing this in 15 places across Ireland. You guys all need to watch out for this. So it's been a fantastic application, and now we're looking at addiction agencies or addiction organizations across Europe that are interested in adopting it. And I think they have a couple in Latin America that are using the same application.
Great, thank you. That's helpful. Yeah.
One of the challenges we were trying to work on is on our healthcare side. So we're working to make healthcare more affordable and accessible for low-income communities. And a huge gap, a persistent gap has been in access to specialty care. So we've done a pretty good job with the Affordable Care Act and other things of building up capacity in primary care services, but specialists were notoriously hard to come by. There were workforce shortages. Patients in the safety net were having to wait 3, 6, and 9 months to see a specialist. Okay, you might be dead by the time you got an appointment. And so we started to kind of unpack that challenge, and we weren't going to address workforce shortages overnight. We had seen some experiments of making the referral process more efficient, but again, that wouldn't really change the fundamental gaps between supply and demand. But there was a technology innovation, which was electronic consultation between primary care and specialists. So imagine just basically doctors being able to securely email each other. That's where it starts. But people were building sophisticated platforms that allowed for, kind of the more sophisticated clinical dialogue and exchange between primary care doctors and specialists. And so what we saw was the potential for if a primary care physician could consult with a specialist, you might not need an in-person visit, thereby freeing up an appointment for someone who needed one. You might see an appointment that was urgent be expedited through this dialogue. And so we found this as a technology solution to be a really powerful tool in solving a system problem, gaps in access to care, wait times for specialists, and also just a lot of times patients were showing up for a specialty care visit without the labs that they needed or without the tests, and the specialists say, I can't do anything. You've not had this test done, I can't help you. So we were seeing wasted visits. They called it the black hole of specialty care. And when you transition back from a specialist to the primary care, there was no communication either. So patients didn't know why they were showing up one place. The providers weren't communicating to kind of really co-manage the patient and support them in getting well. And so this technology solution has been super powerful. And I call it like the gift that keeps on giving, because we know that for patients, who have to take off work and travel to see doctors, having kind of this virtual care support between providers has been powerful for them. It's been powerful for providers to talk about the kind of care that they expect each other to be delivering on both sides of the system. And it's really linked people who are not financially or living under the same roof. Technology was an amazing way to connect people that weren't operating under the same, kind of financial incentives or organizational incentives. And so that's been a really powerful strategy. And we've worked to actually spread that innovation to systems across California. And what we've done in the process has been, this has been, I think, one of the powerful roles we've played as a foundation, is to help people look at the technology solutions that were out there and evaluate them on a number of criteria that were defined by the people who were ultimately using it. So they said what the functionality was. We asked an independent consultant to do an analysis of how the products were meeting that. So that was a really powerful tool. In our spread strategy, we allowed the systems then to do the vendor analysis and the negotiations and things like that with support from consultants. But there are different ways that foundations can play a role, in spreading technology, in providing research and technical assistance around what the solutions are, and supporting communities in some of the negotiations. But I think to pick up on the point of the story about Ireland, it's like this collaborative approach, I think, has just incredible potential, and that's one of the big outcomes that we've seen in this example of when providers collaborated together around a solution. You get efficiency, you get better deals, you get bigger impact, and so I think those are some really important lessons learned from us in this particular story.
So I'm not officially a director of development, but in the nonprofit sector, we're all directors of development, aren't we? So my example comes from driving the statewide campaign for Givingtuesday in Illinois. This had been a brainchild of one of our junior team members. She was a millennial, and she had been involved in Giving Tuesday on a personal level, and she thought that it would be great if Forefront could, as the regional association of nonprofits in Illinois, could be the voice of philanthropy in the state and encourage more giving. So the first year that we ran our campaign, we made a whopping $3 million. For a campaign that we literally pushed out through a janky website, and in less than 3 months' time, we were like, win. But as soon as that campaign was over, we started thinking about the next campaign and the next campaign and setting up a punch list of questions that we wanted to answer. And one of the things that one of the other panelists said was, know what problem you are trying to solve. And so for us, as an umbrella organization of nonprofits and foundations, the problem that we were trying to solve was, how can we get more people who aren't typically affiliated with a nonprofit to give to a nonprofit? So what did we need to make that happen? Both what did we need to trigger donor behavior, but what did we also need to trigger nonprofit behavior to incentivize them to reach out to audiences that they're not used to reaching out to? Long story short, it came down to a platform. It took us, the second year that we did this campaign, we made a little bit more. We took those learnings around donor behavior. We still had a website, but it was slightly less janky, but it was just like not quite optimized yet. So we built, we iterated, we did focus groups on user experience. We talked to donors, we talked to foundations, we talked to nonprofits. And from that, we also talked to vendors. One particular vendor came to us and said, I think we have what you need. They had started out as a volunteer management system, so they knew how to engage people around their passions, and they knew how to trigger certain kinds of volunteer behaviors through gamification, things like that. Then we also started to talk to larger platforms like the big processors, because we needed to know donor behavior. We needed data from different parts of the state so that we could tell after that day of giving where the most donations were coming from, where we knew opportunity was, but if there was a gap, if there weren't as many dollars coming from Southern Illinois, that's what we would focus on the next year. So by the time we got to run the big $11 million campaign, by that time we had built up a network of partnerships between a donor platform, an optimized website. We had done hundreds of hours of training for nonprofits all up and down the state. We had trained all of our foundations on what Giving Tuesday was, what optimized giving looked like, and we shared data around what's the difference between a successful donation and an unsuccessful donation, because there are very particular mistakes that a lot of nonprofits make in their donor pages that literally block 82% of donations from happening on a website. So by the time we did all of that work, and this also goes back to an earlier comment about technology isn't just a widget, it is a culture. We had to do massive internal culture change in our own organization to kind of change the mindset from, well, we just need to tell people what the thing is and then they'll do it. And it's like, no. You have to tell people what the thing is, and you have to train people around the thing, and then you have to keep reinforcing what the thing is and what the benefit is. And so technology and ROI and benefit and impact have to be all chained together in order to be understandable to a person from outside of that community, so that little Miss Johnson from the south side of Chicago, who is running a DV shelter that didn't do so well in her first Giving Tuesday campaign, suddenly is making $5,000 on her second Giving Tuesday campaign, because she's like, oh, this platform allows me to communicate with a wider audience than just these 5 blocks in the south side of Chicago. So one of the things that we started to do after that successful campaign, before I, switched jobs and came out here, was to figure out how can we maintain these partnerships, these data partnerships. So much of nonprofit impact is around demonstrating to funders as well as your individual donors, how the heck do you know that what you're doing works? And so data collection and realizing the potentials for accessible data for your end user, but also accessible data within an organization was just really, really important for us. And that's what really drove the success of that I'll Give campaign. I think impact.
The question was, what were the four process: tech, ROI, benefit, and impact? Great, thank you. Well, thank you all. That's a lot to unpack to talk about the process from beginning to end. So I thought we could start at the beginning. And one of the things that came up, I think, in everybody's response was this question of process and culture, and really culture change. And, as someone, like I mentioned, and probably many people in the audience who, worked in that one lone role as development and communications director for an organization, I imagine people are going to be acting as the emissary of this conversation, going back to your boards, to your leaders, and sometimes to your funders, which I do want to dive into later too. Mm-hmm. And so, organizations that we call digital born, something like a Kiva, which is built up around the concept of a platform as a tool to implement mission, sort of come to the table with an understanding already of what it takes internally in a culture to use a tool effectively. And so I'm wondering if you could each talk a little bit more about, for those of us at organizations where the culture does not necessarily come from this background, and we want to work toward it, what might be a first step in starting to think about integrating digital? And then in addition to that, and I think I want to dive into this now. I wanted to talk about this later, but I think it can be also helpful to really understand the nuts and bolts of capacity. There was a lot of discussion up here of teams. Well, we did this, and we talked about that, and I think that incites fear into the hearts of many. And so let's transform fear into the idea of opportunity and what we actually are looking for. So, where can we start at the beginning and starting to think about this? Delia, you look like you want to.
I do.
Start us off.
I want to jump in so badly. So I've been in the nonprofit sector since 2005, and I came from a corporate background. And so in a lot of ways, not in all ways, but in a lot of ways, the corporate community is just slightly ahead of the nonprofit sector when it comes to internal culture around tech. So I don't know about you all, but
can I interrupt you for a second? You're being serious, right? You're not being sarcastic right now. Okay, because someone could say, slightly, and think, but you're actually being quite serious.
Yeah.
Okay, thanks.
Yeah. So, because I think there are a lot of ways that nonprofits actually do innovate in ways that aren't recognized compared to for-profit sector. Because you have to do a lot with tape and index cards. Yeah. And so, that's an innovation. I think that culture is so important. Culture eats strategy for lunch. I don't know if you've heard that, but that's one of the things that I live by. You can't do a big thing if your environment or your culture isn't ready for it. And so I think there are a lot of organizations where the fault line of tech within an internal culture is literally the difference between email and a chat tool. And so knowing the capacity of your organization, what is the tech capacity or the tech orientation of your organization itself? Are folks struggling with Outlook and the concept around Outlook? Then, if that is the case, then pivoting toward a more digitally robust environment is going to take a lot of internal culture change. One of the things that I've found in my experience that has helped that is in every team, and team I'm using very loosely as organization-wide, in every team there is always a super user. It doesn't matter what generation they are. They could be millennial. They could be bitter Gen Xers like me. But there is always a power user somewhere who is tinkering around and sometimes is like, I found this thing that I think we should do. Why don't we test it out? And then other people who want to be with the cool kids are like, yeah, I think I'll try that too. We did this at one of my past organizations, and it was around Slack. Slack is a communication tool, and you can use it for project management, you can use it for document sharing, you can use it for all sorts of things, and it can integrate with all sorts of other tools, Salesforce, Outlook, whatever. I think it's wonderful. This became literally a rallying cry and a dividing line of generations within our organization. Those who were Slack positive and those who were Slack negative. And what happened, though, is as we began to run larger campaigns like I'll Give, external teams were also using Slack. So it became a more rational and common tool for collaboration and cooperation and communication. But that didn't happen right away. We had to be really stubborn and really rude about it and forcing use. Forced migration. It was kind of ugly, but in the end, it became a Slack positive organization, and so now people can't imagine not using it. But that kind of cultural intervention, when you're talking about building a culture around innovation and digital robustness, is really, really key. But it has to be intentional. And so that's my one small micro example around that.
I think for any kind of change process, just constantly grounding everything in mission.
Yep.
And reminding people over and over and over again the connection to mission, because I think once you start implementation and things get hard, people quickly lose sight of why are we doing this anyway? And so I think just constantly reminding people of the problem you're trying to solve for, the impact that it could have on your clients or the people you're trying to serve or your donors, saying that over and over again throughout the process of implementation so people remember why we're going through this thing that feels hard in the first place, I think is really important. The other thing is developing multiple value propositions. And we learned this through some of our work with communities where different people in an organization or different people in the system even have different whys. So your business and finance person might have their why. Your frontline, the person who answers the telephones or processes people, into services might have their why. But constantly looking at technology and thinking with the hat of what are all these different people's whys and how will it actually make their lives better or easier, in addition to the clients we serve or the problem we're trying to solve. But there are multiple whys for people, and so really understanding that those different whys and servicing them and articulating them. And then I love the super user comment. I think there's collections of champions that you can build that sit in different spaces. And I liked there's the early adopter, there's the people the cool kids, curious group. So I think there's a lot of different champions. And I think the unsuspecting champions, are the fun ones. Of course, we could all assume younger people are going to lead the technology change. But for the unsuspecting, champions, I think, can bring, and people who are influential in the organization. When we started doing this electronic consultation work, they said, find the nice specialists. They don't have to be the best, they don't have to be the best, the top, the whatever, but actually find the ones that are nice and they want to teach other people. And they're kind of your lever for showing people how powerful this technology solution can be for doing the work better. So it can be people with kind of unsuspecting qualities and characteristics.
Your example about Slack made me laugh because we're doing the same thing. And we're a technology, our whole orientation is around technology, and shoehorning people off of Skype into Slack has been really hard. We're a 30-year-old organization with 200 people around the world, and getting people to move, it's hard. So for me, what we see as successful with digital transformation is kind of a first step, baby step, and the one I kind of universally recommend is get your email in the cloud and get your documents in the cloud. And for most, I would say like 80 to 90% of organizations are using Microsoft, right? Everyone's using, Outlook, Exchange Server, the Office apps, Word, PowerPoint, Excel. Some of you guys see you're shaking. Well, I know some organizations are using Google Docs and Google Mail, and there are trade-offs to that, and there are expense differences in terms of backup and storage between kind of Microsoft Cloud and the Google Cloud, which I know a lot about, and I'm happy to talk about. But if you have a staff that's using Office apps and Outlook and Exchange, that's a really easy transition. Mm-hmm. The Office 365 Cloud solution is inexpensive. Some of the licenses are free, some are paid, depending on the level of compliance and security that you need. And you can mix and match them. And when you transition people, when we do implementations of Office 365, the first thing that we do is an email migration. We move everyone off of the local Exchange server into the cloud, and most staff don't even notice it has happened. You do a cutover migration, and people are like, maybe something is moved, or like a color is different. They sort of sense something is a little different, but they can't quite put their finger on it, but it doesn't affect their work and their productivity, and they carry on and they're fine. And then the same with the apps. It gets a little bit more complicated with document storage, and that's always a big project to get organizations to think about where they're storing their documents, how they're categorizing them. I know we have 30 years of documents sitting on various drives that we've got to get sorted through as well, and it's not an easy process. And some of those things you just have to let go of and say, you know what, we're just going to delete that. Yeah. That spreadsheet from 2007, we are going to delete that and not look back. So I find email and documents are sort of a really good first step in terms of digital transformation and getting your staff used to the idea of using cloud-based tools, which is where everything's going. Not, because the commercial sector is pushing in that direction, we don't have much choice but to follow it. So,
great, thank you. It's a really good operational deep dive into the tools and how to get started internally and to start thinking about technology in a larger space. I'd love to switch gears now and talk a little bit about the use of technology in our mission and how to achieve our mission. And one of the really interesting articles that I always point clients to is 9 Transformative Pathways to Scale, which is the Stanford Social Innovation Review in partnership with Bridgespan article that came out in 2014. And it's a really interesting way to sort of think about big picture opportunities to achieve scaling of mission and impact, which is something that, as we know, we really want to do, all of us as organizations. Now, one of the ways that they talk about is using technology to reach larger audiences. And I think there were a couple of examples that came up that I think were really, Rachel, the example that you gave of transitioning practitioners so they could speak with people virtually it sparked in me a really interesting concept of like, well, what if we did that at small local organizations? We created opportunities to talk to the populations that we serve. Would that save us time? Would that save them time and opportunity? And yet sometimes there's a cultural block or lack of knowledge about how to start for something like that. So could each of you talk about maybe an example of how you've seen an organization or nonprofit organization really reach customers to help scale, not customers, excuse me, but use communications to help scale impact?
Are we starting with me again?
Okay. Sure. Whoever would like to start, yes.
So there's an organization called Freedom House, and they work with adults with mental health issues, and they provide housing, and they provide counseling, and they provide courses. And they went ahead and implemented a Cisco telepresence system that allowed them to they have locations around the United States and around the world, actually, and this telepresence system allowed them to run courses and classes or counseling sessions in one location and have people from another location participate. And that way they could take advantage of multilingual situations. So they have a big center in the Bronx and a big Spanish-speaking population. And they were doing telepresence sessions together with an organization in Los Angeles that also served a Hispanic community. And so they were able to kind of pool their resources, spread their impact across all of these organizations that had constituents that were able to collaborate and communicate together. And so that, that was an example of impact. Another quick one is Caravan Studios develops apps that can be used for, they have an app that helps kids find free lunch programs in the summertime when school's out. So you have kids that take advantage of free lunch programs, and during the school year they don't have access to it in the summertime. And so there's this app called Range, which community, church leaders, librarians have, that they can, when they identify kids that are looking like they're never getting any lunch, they're spending all day in the library or all day at the basketball court or the community center, and they're not taking a break for lunch, they can point them in the direction of places to get free lunch. So there are a lot of these kind of applications that are being developed to help extend impact and bring in other people who are not necessarily volunteers or staff associated with the organization.
I think one of the interesting trends we're seeing in terms of health and other social issues is nonprofits thinking more about spatial analysis and using tools like geographic information systems mapping to really say, hey, we're all working in sectors or specific service lines, but it's actually we're all serving the same people. And by the way, these people all live in the same zip code. And so I think that's an example of when you use technology to really kind of think differently about who you're trying to reach, who else is trying to reach them, and then thinking about the possibilities of collaboration. And they've done something called hotspotting in Camden, New Jersey, where they looked at where we're all, frequent utilization is a problem, ER utilization, people using the ER for they call it non-ambulatory sensitive, or ambulatory sensitive conditions, things you don't need to go to the ER for. But they did some analysis of their data and found a group of people were living in the same building, all coming, that were going into using the emergency room for care, and they could have been going to a primary care physician. So once you do that kind of analysis and that spatial analysis, possibilities begin to open up about what are the needs in that community, who's best positioned to meet the needs, how do we collaborate together in new ways to really kind of surround communities with the array of services and supports that they need. The other innovation we're seeing more and more is population stratification, and that's a fancy term, but I think it's this example Delia used of what are the characteristics of these folks? They've never given to a nonprofit before. They aren't connected. There's some, once we get really good and trust, commercial marketers are doing this with our data all the time. What does Rachel love to read, eat, buy, so I think if we brought that kind of sophistication in thinking about data to our sector to say, a person who is homeless today has different needs from a person who's housing insecure. And we could structure our work. There are different kinds of services and supports people need depending on, where they're at in terms of their level of need. And so I think we can use data in really creative ways to bundle different services together so that we're not targeting everyone broadly with the same things that might not be relevant for who they are, what they need, and what they want. And so we're seeing some real interesting ways that nonprofits are using data to kind of understand and group their population in different ways to really kind of meet their needs. And I think you could do that, whether it's fundraising, whether it's service delivery, whether it's advocacy, you can think about, who you're trying to target in a power analysis for legislative change. People are different and you use different strategies. So I think technology can be powerful for that.
So my example is literally about that last thing, about using data and technology for advocacy targeting. How many of you have heard of Cambridge Analytica? Yeah. So that's the dark side of the moon. But I think a lot of these, I think something to remember about technology is that it could be used for good or bad. Someone said earlier that it's not so much about the technology, but about the person or the organization that's wielding it. So targeting and micro-targeting is very cool, kind of a mystery to me, but it can still work. So my organization, ERA, Equal Rights Advocates, we are a nonprofit legal organization. We are a civil rights organization working to eliminate gender discrimination wherever it happens, in the workplace or in school. And we do a lot of public policy legislative work in the Capitol and at the federal level. So we had introduced a slate of bills just this past legislative session, which is just about to wrap up here in California. And we wanted to, one, build our list of advocates because our list was getting a little bit stale. We weren't getting as much activity and engagement from them, so we wanted to inject new life into it. The way to inject new life isn't to keep bombarding them with, come on, please, do this thing for us. It's to get new people in and then bring them through a cycle so that you can bring new people in on a continual basis. So we had the slate of bills. We had an event coming up down in Southern California, and we wanted to be able to launch this slate of legislation in Southern California through a petition. So the vendor that we used, they had a service that would basically, you know, you can pay for us to target new advocates for you. What this, and it was successful, you know, we paid, it was basically $1.33 per advocate, and we used all of that money. We got our money's worth for that. One, these things come with a cost. Two, it forced us to be really strategic and really thoughtful about who we wanted to target. And so this question about segmentation and audience and knowing who you're trying to trigger is really, really key. So I think being an organization that is willing to embrace digital and technology, accidental actions are no longer allowed. You have to be thoughtful. You have to think ahead. You have to think like the person you're trying to engage, and then you have to think beyond that. That kind of thinking isn't necessarily natural to a lot of organizations. That kind of thinking isn't natural to a lot of teams simply because of capacity constraints. And so this also connects to capacity concerns. As folks are thinking about what it takes to be a digitally transformed organization, it takes a lot of time to think about the strategy, about what your digital strategy is, and then once you implement that strategy, you still need time to analyze that strategy. How well did it work? So we've run this campaign couple of months ago. We haven't had the time yet to go back and dig into that data. And so that's the next step that we have to do. Even though we got new people on our list, we had new people that we are now engaging with, and we have all of this information about them, not just where they live, but their educational level, who they vote for, that kind of thing. Now what do we do with it? So that's a challenge for us.
Can I jump in on that point around data? Because we've been doing a lot of thinking around this and advising organizations, and organizations are clearly getting into this. You know, we need to collect data because it'll allow us to target better, analyze better. I beg you, please be very thoughtful about the data that you're collecting. Look at each piece of data that you're collecting on whomever, whether it's donors or the people in your domestic violence shelter that you're serving, and ask yourself, what do I need that data point for? And do I need to collect it in exactly that way? And then how long is it good for? Like, when should I delete it? Because this is the big problem is people are hoovering up data and there's no data deletion policy. You know, nobody's thought about, like, how long should I hang on to this for? Should I hang on for 10 years? And so there was this great example that I heard this woman who was from a domestic violence shelter in DC talking about. She said, we looked at our questionnaire and we realized that we were asking people about drug use, because when people are coming into some of these shelters, they have drug problems and they want to assess whether they need to be provided extra services around drug counseling. And she realized that that was a data point that could at some point come back to haunt that person. If they're saying, yeah, this person has a history of cocaine use and amphetamine and opioid, and then 10 years down the road, that person is trying to get a job and it somehow pops up in their medical history that they were a drug user, that could be really detrimental. So can you ask that question about, so what you're trying to understand is, what's the service that this person needs? What kind of services do they need? Do you have to ask, like, what drugs are you using? Or can you ask, you know, do you have any issues that you're concerned about? You know, I don't know, you have to figure out a way to phrase it. And then my other big pet peeve is dates of birth. Can we all stop asking people for their date of birth? Do you really need it? I mean, unless you're like TSA or social, like, do you really need my date of birth? Health organizations, I think, is a little bit different, but I had a big fight with my kids' soccer club, which is a nonprofit, you know, and youth sports organizations are particularly terrible about this because they're families and they're happy and they're friendly and it's sports and they're collecting information about my kid's date of birth. And then they also wanted me to upload a scanned copy of my children's birth certificates.
Wow.
Whoa. And I was like, no, I will come and show that to you to prove that they are, you know, the age that, you know, because they're like in youth sports, there's all this nonsense about kids playing down, you know, like there's a 14-year-old playing on a 12-year-old team and the parents go nuts. And so, you know, like, do you need my child's, and then, you know, and then I asked them, like, what's your policy for deletion of that scanned copy of the birth certificates that you're collecting from 2,000 children across the East Bay? Because, you know, a hacker finds out that there's a database full of all sorts of information, including date of birth, and a copy of your birth certificate. That's a gold mine. And so, so think carefully about what data you're collecting, why you're collecting it, and how long you need to keep it.
I think that's
Please delete it.
Yeah, I think that's helpful, and I do want to continue. I know you have a comment about data, which is we could have an entire session on data specifically in regards to nonprofits, but we'll only have half an hour more, so we won't. But I do want to talk a little bit more about it. And Rachel, in addition to what Delia is going to say, I'm curious to know from the foundation perspective, since foundations now, as we know, ask for more and more metrics and they're asking for data from beneficiaries, I think with the good intention of wanting to understand impact and delivery for investment. But if you could speak to that specifically about what organizations should be asking foundations, how foundations should be asking, that'd be great too. And Delia, did you want to add on to the data piece?
I did, but I'll do that after Rachel.
Okay.
I think the question for us is just this. It's very similar to the question for the nonprofit, which is we have to get serious about how we're using the data we ask for. So that's been something. I mean, it's a question we're asking ourselves all the time in our own processes, whether it's grant applications or grant reports, and we have to get serious about, if we're asking for it, how are we using it, whether it's internally, how are we using it externally to tell the story of the work that nonprofits are doing, and really to communicate learning to the field. So I think as a foundation, we're trying to hold ourselves, you know, to a better standard. There's been, I think it's called Project Streamline, where they've asked these questions, they've pushed foundations to say, you know, what information are you collecting, how are you using it, how do you make that less burdensome? I've been in a couple of projects, you know, foundations always talk about how to, the joint applications.
Oh, yeah.
It's a nut we can't crack, I will tell you that. I mean, I've been on different committees where we tried to do it. So I think nonprofits can keep pushing the sector and telling us how you think we should do it and how we should collaborate. Because it's really, a force from the outside is powerful to get foundations to change behavior. I know that's hard because there's an obvious power dynamic between nonprofits and funders, but I think if nonprofits come together and ask and make a joint ask, like use your collective power with foundations to get us to behave in ways that makes sense for your operations as a sector. I think that's one way that you get change, by pushing foundations from the outside, quite honestly. And I think, for us, again, it's sort of the responsibility we're working on is sharing out what we learn, because we're keepers of a lot of learning. And that's an obligation that we owe back to the field, because we see things that work and don't work. All that we get great. I mean, those who are willing to be transparent with us, nonprofits, we get amazing information about things that work and don't work. And we really should be sharing that out with the field. So I don't know if that answers your question, but those are some of the issues that we grapple with as a foundation.
I think that's helpful for us to understand from that point of view. And I also this is a moment to make a plug for the Foundation Center, which the Foundation Center National, you'll have to remind me the name of the website, but has done a tremendous job, I think, in the last year of actually taking information from funders and reports. It's issuelab.org, and it's really, if you have not yet visited it, if you're a nonprofit or if you're a funder, it's an opportunity to share all of the information that funders have requested and the reports that you've done. It's really an excellent source, so I want to make sure folks know about that. Delia, did you want to add about data?
I did, and I think Rachel said exactly what I had in my notes earlier, and I just want to add to it. So for nonprofits who are working in the human services space, I think there is this tendency within our sector to look at big tech as the savior, right? Like, we have big problems, let's disrupt the heck out of all of these human service challenges that we're being faced with. But there's a wonderful new book called Automating Inequality by Virginia Eubanks that posits that in this new regime of data analytics, the most invasive and punitive systems are aimed at the poor. So this really does behoove nonprofit organizations to think very clearly about the integrity and the ethics of tech in your service area. How, not just how you're using it, how you're storing it, but what is it going to be used for? The unintended consequences of certain kinds of data and technology use. I think that kind of an intentionality is really, really important. And I think on the flip side, on the other side of the funding relationship, foundations and philanthropy also to consider that. If we as a sector push nonprofits to engage more with technology, and this isn't to say that nonprofits shouldn't use technology, but it is a question of strategy and integrity and who, what, and why. Like, are we sure we want to do this? That kind of thoughtfulness, I think, needs to happen on both sides of the relationship.
That's great.
Can I add something to that?
Sure.
I think this question of always engaging the beneficiary or who you're interacting with in those conversations is really important too. I mean, in some of our projects on the healthcare side, we've seen, patients have more liberal views about data sharing. If they thought it was going to benefit them and they trusted their providers, they actually may hold liberal views about sharing data that actually the providers impose their own view on what they thought should be shared or not. So I think having a dialogue between both whoever the person is collecting the data and whoever the beneficiary is, whether you're a foundation and a nonprofit or a nonprofit and a client, but engaging in that conversation together about, what you're collecting and how it will be used, and creating a transparent process around that, I think helps to get at some of those equity concerns and unanticipated challenges. And, always thinking about for yourself, even what would you want shared or not, not thinking about the other, but, ourselves and what we're comfortable with too.
Thank you. I want to open it up for questions. I do want to just ask one final question to the panel before I do so, which I feel like is the key question that wraps this all up too. You know, we've talked about the need to have security for data. We've talked about the need to have systems and process and consultants to bring all of this into place. I think it can be key, you know, from what I've seen working with product teams, to have, you know, both a technology officer in place at an organization and or a communications professional. And that's often a far cry from where a lot of us are as community organizations with an IT professional on staff. And so I wanted to ask the panel what you're seeing, how are organizational, and I would say individual too, funders and donors sort of reacting to and supporting technology in the impact space. It seems to be something that is growing, but I'm curious to know who you see, what should we be asking for when we're talking to our foundations. I just want to repeat what Rachel said when I had some conversations with funders around, you know, how are you supporting organizations and their technology? Some of them said to me, well, we hear from them what they need. So I do think that the organizations are looking to nonprofits to share with them what it is that you need. So can you talk more about the funding landscape for technology?
So when I worked for this Regional Association of Philanthropy, I think this is a good example of how philanthropy in Chicago responded as a body to a crisis right after the election. So right after the election, and rhetoric around immigration and immigration status started to really ramp up. What a small group of funders, and funders who particularly funded in the immigration space. So they funded all sorts of different organizations who touched different immigrant populations. What they were hearing, as soon as the election happened and this rhetoric started to roll out from the White House, they reached out to their grantees and they wanted to know, what are your communities afraid of and experiencing? They got responses in two categories. And so nonprofits were telling their funders, one, we need doors, because if ICE breaks in, we need a way to hold them out. So they needed physical things in their organizations. Then they also asked, we need a way to safeguard the data on our clients, because we have never had to worry about this before. And so that group of funders they put up Gen Ops funds for this group of grantees around data protection and security, trainings, leadership development opportunities, but also hardcore, this is what you need in order to safeguard your client data. That, I think, is... these funders had never thought of that before. They had never even thought of themselves in a position of, okay, now we're kind of unofficially part of the resistance. And so this was a new way of thinking about strategic grant making, and also a new way of thinking about capacity building.
I think foundations come at this question from a lot of different angles. So it's hard to answer for the sector. I mean, I can speak from our experiences and some of what we've seen. I think some foundations come at it from a capacity building lens, to your point about, what are the basic infrastructure that's needed in the sector to be effective and efficient, and how can we support that work? And I think, any time that you can, I love this collaborative ask. That's powerful. We've seen a lot of strategies that use intermediaries, so organizations like a TechSoup or a group that can come in and help a group of nonprofits all together that can function as an intermediary, versus seeing one proposal from one nonprofit at a time for a variety of different infrastructures and supports. We often work through intermediaries. I think, and on the point of intermediaries, a lot of foundations are impressed by nonprofits that leverage their donor base for some of this stuff, because some of it is really skills based, and you can find really solid volunteers out in the world who can help you build that capacity. So we've seen models like that too, where different folks can leverage the support of individuals in the community as volunteers to help them build some of the capacity. I think on the innovation side, foundations, love testing and trying and piloting new things. And so we often will support kind of small experiments or tests of change that a nonprofit might want to do to better deliver design services. We're interested in scaling, so I think that's on the point of collaboration too. Like, how do you bring a particular solution to scale? We're seeing some interesting experiments now with partnerships between nonprofits and for-profit organizations. So we've seen some safety net healthcare providers look at using Lyft and Uber for medical transportation and forming new partnerships with those kinds of entities. On our DV side, we've seen some interesting experiments of partnering with local hotels to provide shelter, and apps that are created to understand where the vacancies might be. So we've done a lot of support of kind of small experiments, and then if they're working, improving, effective, bringing them to scale. I think the joint measurement work is also, the example again from Ireland is really powerful. Foundations love that kind of stuff, to see how are nonprofits working together to track and measure their impact, not just within their organization.
And call it collective impact.
Collective impact, yes. So those are some examples. I think in evaluating, I was kind of thinking about how we evaluate different kinds of proposals, and I think some of it is going back to, the solution has to match the problem. And so that's something, I think we'll always ask of, well, how would this technology project or this innovation, how would it solve the problem that you're working on? This demonstration about this the challenges around implementation, so that it's not just we buy the thing and then we implement it in like 2 months and then it's all done. So I think when we look at technology, we look at, are there realistic time frames? Are you seeing through, do you have the project designed for a full implementation? Or do you just think it's going to kind of be this plug and play solution? And then of course, plans for supporting the long-term costs. I mean, this has been a huge challenge, I think, in healthcare in particular, and the proliferation of tools, but you have to have a business plan. And I don't think a lot of foundations, we can't afford, quite frankly, to support the ongoing costs of technology into nonprofits. And I'm sure this is an issue TechSoup and others have worked on, but there's a lot of business planning that has to be involved in adopting new solutions. I think I'll stop there.
Okay. So I will say that the Blue Cross Foundation stands out. You guys are on, I think, the end of the spectrum where you are very technology friendly and savvy. I have a good friend at a very prominent San Francisco foundation, which shall not be named, and they as part of their grant making, they absolutely say you cannot use this funds for anything, capacity, any operational kind of technology capacity building. They just say, our money goes to programmatic stuff and it doesn't go to infrastructure. And I keep beating her up about it every time I see her, because it's like insane to me. So I think that there are a lot of foundations out there that don't understand. There are big foundations like Blue Cross or Blue Shield and the Gates Foundation, Mott, Ford. You have the big ones that they kind of get it, and then you have like a million family foundations and community foundations and that don't really understand why they should be funding tech. And it's important because it's important for the operations and the long-term sustainability of the organization. It's also important because most individual donors, like when you get hit up at the end of the year to donate to Planned Parenthood or whomever, most people are saying, I want my money to go to operations. I want it to go to that program. I give to Heifer International because I want to buy a cow for that family in Haiti or whatever it is. And so there aren't a lot of people who are willing to fund the technology back end, and it's important to have those conversations in a way that's very direct and communicates the benefits of the actual impact. So if you can somehow say, look, this is going to allow us to reduce staff time in paperwork so that we can save more puppies, or we can get more volunteers. We can have more impact, and drawing that line is important. One of the challenges with this movement to the cloud, so everybody gets that this technology is moving to the cloud, whether you want it to or not. It's kind of the way it's going because it's being driven. It's the new business model of the tech companies. So your software is you're accessing it through the internet. It can be installed locally, but it's it's controlled, and it syncs back with the the mothership, the Death Star, however you want to think about it, and you pay for it. You don't pay for it like you used to buy a license. You used to buy that Microsoft Office license. You'd pay your $300 or however much it was, and then you ran that sucker for 5, 6, 7, 8 years until it no longer worked with whatever else you were working, and then you forced to upgrade. That's not how it's going to work anymore. You are going to be paying $1, $2, $5, $15 a month per person for that license for as long as they use it. It's a completely different business model, and there are a ton of advantages to this, but there are disadvantages, particularly around funding, because funders look at OpEx, right? They want to look at your OpEx, and they want to see that you don't have high overhead, that you are not spending a lot of money on operational costs. And technology used to be in CapEx. You buy some computers, you buy a server, you buy a bunch of software, and that all went into your CapEx. And funders don't look at CapEx because those are one-time investments for, the building of the organization. They look at your OpEx. Guess what? Cloud subscriptions are OpEx. And funders, and suddenly all that money, those, however much you've got budgeted in your organization, $50,000, $100,000, that used to be in CapEx is now shifting, and it's going to be in OpEx. And funders are going to be like, wow, So you have to have that conversation with them to explain how you're using technology and why it's important and why it's useful. We're also trying, at TechSoup, we're trying to do this whole education of funders. We have a big funder services, which I think you're probably familiar with, NGO Source, that supports foundations in their giving. And so we're trying to do some campaigns around that. But, it's a challenge. And then I was going to address the other part of your question, Cassie, around technology, and do we all need CIOs and CTOs and IT directors in our organizations? I think it depends on how big you are, how many staff you have. At some point, you're going to need to bring somebody in-house to think about strategy around your technology. On the other hand, I'm a big fan of outsourcing stuff that you're not good at or isn't your main focus. And there are lots of providers. TechSoup is one, but there are lots of others that will manage your IT for you. You can outsource somebody who will reset your passwords, will clean up the viruses that you got on your computer when you downloaded that cat video, will monitor your servers, will ensure that those data backups are actually working and didn't stop working 6 months ago and nobody's been paying attention. So there are managed IT support services, there are help desk services, there's even a service that we work with a partner on called a virtual CIO, where you can rent a CIO for a month, 3 months, 6 months, and they can come in and do a big strategy project around your IT, and then let you go off and handle it, or they can be on retainer. So I think outsourcing tech to people who do it all day, every day, is a really good idea if you can, if you have the funding for that and if you can make that work.
Yeah, I think that's right. And I just want to add to that and then open it up for questions that I think that knowing to ask for technology capacity building support, that's not a phrase that we hear much yet. I believe it will be growing. And I think that in addition to what we think of in terms of IT or engineers, there's a whole technology product side of things. And that's where some of the phrases that we've heard, like human-centered design and design thinking, I think come into play as well. And it really is the folks who think about developing technology products from a strategy side every day. We're the ones who can come into the organization and help you think through things like usability and deployment and long-term support for that too. And that's really a very unique, at this point in time, I think, skill set. So I wanted to open this up for questions. We had an initial question from the live stream, and I would encourage folks who are listening in via the live stream to also type into the chat box your questions, and we'll answer them. And for everyone in the room to come up, and I will relinquish my microphone to you to ask the question to the panelists up here so the folks on the live stream can hear it as well. But the first question was just to name again the website of the organization collecting data from nonprofits and foundations, and that was issuelab.org. Which is, again, not just a place to find information based on Foundation Report, but all of the grant makers who are listening in should also know that that exists, and that's a place where they can go and share the information that they have learned over time as well. It's a growing resource. I think it's probably about a year old. Is that correct? Oh, I'm so sorry. It's so much older. I've known about it for that long, so please, everyone should know about it. So I'd like to open up questions to the audience. Yes? Will you come up to the mic and ask the question yourself? Thank you.
First of all, I want to say thank you so much to the panelists for sharing your information with us. So the question that I have for you is, basically, I've personally worked in the nonprofit space for the last 20 years, for everything from a small nonprofit that's $500,000 budget to over $17 million. I'm right now with the Chinese Culture Center of San Francisco, and we're $1.5 million budget. So you, Cameron, brought up a really great point about how technology is part of our operating, and it's not recognized as really part of programs, right? I mean, if you think about it, we all use technology today, whether it's our cell phones, you know, you talked about the different apps. How can we get, whether it's foundations or other funders, to support the idea and start talking about how technology is part of programming, right? All this operation stuff is part of programming. And I'd love to hear that. And then also the title of the article that you mentioned we should take a look at.
Sure. 9 transformative pathways to scale. And I noticed that they've done more work around this integration of technology into the sector as well recently.
So, sorry, I got distracted about the article. What was the...
The question was asking specifically, how can we think about inviting our funders and other supporting organizations to programs?
So I think that you take advantage, I mean, right now it's about Cambridge Analytica and data security, and getting funders to understand the importance of technology is going to be your best chance, and best buzzwords right now are going to be about data security. And the security that these new technologies allow you to put into place around the data that you collect on your constituents, the data that you collect on your funders. You know, a lot of organizations are collecting data on their big givers, and they collect the donor's name, the donor's husband's name, the kids' names, the birthday, how much they gave each other each year, credit card numbers. So you want that, you want that data secure, and that's getting more and more difficult as, you're being pushed into the cloud, and if you want the cutting edge security, you really need to do that. It's particularly easy with organizations that are dealing with compliance issues, HIPAA compliance, that, the really great compliance features and functions are going to be in things like Office 365 Enterprise 3 licenses, where you get the legal hold, archiving of email for legal hold purposes, and some of the Active Directory security features that are going to be important to meeting compliance. So I think that's one thing. Another way, there's an organization called PathPoint in Southern California that does health and human services work, and they were really able to ratchet up their efficiencies by moving to they moved to Office 365 because they had all these mobile staff that were out in the field working with people kind of in the farm countries, and then they were having to, those staff were collecting all this data on their local laptops, and were having to drive all the way back into Riverside and then upload it to the server, the P drive or the D drive or whatever it was that was located on premise. And by putting everything into the cloud and getting all the mobile apps, they were able, their people were much more efficient. They spent a lot less money on like driving back and forth to the office and uploading data. And then they have there are all these other features that come with these cloud apps where you can do stuff on your phones, you can do stuff on mobile devices, you get wireless hotspots. And so there's just a lot, it depends on the type of organization you are, but there are a lot of efficiencies around operations that you can gain. And if you can figure out what those are and demonstrate that this is important to this program serving more people, or cleaning up, maybe you're an environmental organization and you want to buy drones to go and survey landscapes for environmental study purposes, or you're a relief organization and you're trying to drone in, you're trying to take pictures of areas to figure out where you need to drop in aid. A lot of these technologies are really important and transformative in terms of being able to deliver impact.
I think also, when you're thinking about how to make the case that technology is part of your operational or your programs, how you present it in the budget is really, really important, because your program officer is looking at your program budget very, very closely. I think there is a small cadre of foundations now who are across the country, and particularly here in California, the Regional Association of Grant Makers, both in Northern California and Southern California, I think, came together and released a statement around how they want to increase their commitment to overhead and in funding overhead.
Yeah.
Part of that is how nonprofit organizations present their program and operational budgets to demonstrate that all of these core building blocks of an organization are shared across functions. So fundraising, executive, operations, but also programs. If you are making the case that your programs rely on technology, then your program budgets have to show the percentage and what that formula is for that expense. So building the case through your budgets, I think, is really, really key, not just in your narratives.
I think too, how you tell the story or create the narrative around, I love this idea of blurring the lines between operational and programmatic and the role of technology, because there isn't really a clear dividing line there, but I think it's how you communicate that story and also communicate the impact. And I think going back to the mission part and the human experience of the work and who you're reaching and how you're reaching them and how the technology is allowing you to do that is always compelling, and how that changes the experience for the client is always, it's fundamental to the way foundations look at the work, and it's key to the impact that you're having. And it could be also like the impact of a policy campaign or a success, or how many people you mobilized, and how the technology was a critical infrastructure for you to do that. So I think that how you weave the narrative, both to kind of blur the program and operation lines and to weave it to impact, is really key.
That's great. And I think that wraps us up for today. It's a really nice note to stop on, is to think about how to integrate technology tools into the story of what we're doing, and to help our missions and our visions go farther for the beneficiaries we serve. Thank you so much for being here, all of you. Enjoyed the day, and please, thanks to everyone in the audience and on the live stream, and we look forward to continuing the conversation.
Thank you.
You had a question, didn't you, that we didn't get to?